the depression short because, and I told you so many factors which are basically affecting this depression. The, as I said, about biological factors, so sociological factors, economical factors, then I was talking about even the psychological factors, and quite a lot of things, the physiologically surroundings, environment, a lot of things which are coming as the things goes on and on and on in our day to day life. Well, and nowadays in this generation we are having a work pressure, we are having so many other surroundings of family, children, their studies. It's like enormous things which is moving around, and we are coping up one after the other with everything in the case of the depression. So let us take out, first of all, the depression if we try to divide, and especially in case of our ladies, if we are trying to take them. The ladies have got so many other problems as well. So these are the things, and that affects your body, that affects your up and down dietary habits. So let's take up first of all the long term depression and a short term depression. Short term depression is just for the timing or for few days or something. It's good to recognize these kind of the depression or these kind of the depressive moments and to come out, because these particular short term depression is not just one thing which is there. It is sometime, person gets depressed because of so many factors which are affecting to them, and they get moodless. If children, they have got their own problems, they get moodless, and this is a mood behavior. It's like a up and down mood basically. So let's take that first into the action. So let's take the short term depression in account. First of all, how it is affecting and why it is affecting. So, if we take it in the children, there are a lot of reasons to have these kind of the short-term depression. And the first is they have got they have got environmental change. They have got they see the consistent sometimes the argumentative, they have got the friends problems, the teenager have got the breakage, heartbreakage, fightings with their dear friends. So there are a lot of things which are there with them, and then that particular kind of a depression, that is one thing. Secondly, the depression comes due to the work pressure. Work pressure is a very common factor nowadays, which is given to the person, and they come up. When you go to your work, you don't realize, and your thing come, the you are stressed because you have to finish with the target, you have to finish with so many assignments or so many things. In school or a colleges, when you go, you are bonded with so many of the work and homework and all that, and then the examinations, the competitive examinations. That's another. And that happens not in this country, but the other countries, it is very, very common that it happens. And then the people, the student, they're basically, they come up with so much of a small hiccups and the stress. Basically, it's a stress. It's like a force. You are giving a force to your brain. The brain, as I always say, the brain and the body, they are like a parallel track of of your life. And what happens? This particular brain gets some sort of a force that yes, I have to do this, I have to work like that. So that's the one which is creating a lot of tensions amongst the person. When you are at a work, your boss puts a file pile up or some of the things to finish with it. And that's the another problem that you face. So think in your case, when you are having all these trouble and when you're having these stressful position, it's one thing. Always remember, this is a normal. Diversify. Or secondly, argument. Nowadays, it's a very simple thing because of the inflation, the household income, and it is very tough to run the house. The demands of the children is keep on increasing with the branded things and non-branded things. The demand of the uh, wife and husband, a girlfriend and a boyfriend, these both, it's very, very hard to cope up with. And you come up with the arguments. These arguments, even if you have got a very intimate relationship between each other, you don't understand, you misunderstand each other. Start accusing each other. And then what happens? The end point is, well, you stressed out, aggravations, aggressive conditions, and anger. And that makes you to go ahead and create a little bit of a other trouble, the comorbidities or the falling into some of the problems. So make sure of all these. I'm taking the one thing, the short term comorbidities and a long term comorbidities, because short term comorbidities is different and they are different. But if that short term continues further and further, then you're bound to end up with the long term. So these kind of the argumentation, shouting, loud voice, this all the things, they put you to some of the problems. And what is the thing? Why stressful? So what you do in that situation? Go sit down quietly. You understand? You're not in the position. You're not in the position to talk, or you are depressed, you are moodless. What you do? Keep calm, keep away from that. You try to avoid, as I said, avoidance. Avoidance is another factor. Some of the then you avoid that society, you avoid that kind of people, try to separate them, and the stressful part of it, you try to come out. How can you come out when it happens? It's these are the common factor which happens in our day to day life. Sorry, I'm very much tired, so I'm just trying to relax and give you a lecture. So just try to adjust with me today. Now the thing is, when such situations are happening, this is a normal day to day life. When you are at work in the morning, maybe your boss must have had a fight or a very big argument. So he comes and that anger comes on you. What to do in such scenario? Calm down. Don't say anything. Sit down by the side. Have a nice cup of tea. And then think whether I can accept this or I should not accept. Your brain is a main willpower. It's like a powerhouse of your body. So what to do? Understand the powerhouse of your body. Listen to the powerhouse. My bosses said that how I should react. Some people they react abruptly. Start. Pa, 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 pa. No, calm. Listen to them. Then have a glass of water. Calm down. He said to me these. Now, can I digest it? Can I take it? Or just let them speak, whether it's a 10 minutes, whether it's a 15 minutes, whether it's a half an hour. Let the things to happen. Then your brain doesn't understand this. They can't take it. They get saturated. No, now I can't take any longer. Just move away. Moving away is the best part of that stressful condition if it's a argumentative. But if it is a stressful condition at the work, what to do? Let the things to stay there. Then think about it. Whether these kind of a challenges, this kind of the excessive work, this much whether you can do it or not. Okay, today I'm taking a challenge and doing it. That your brain says, okay, take it once, not every day. So you take it. That's your brain's suggestions. Your body will adjust with that. That is another suggestion. Today I'm not feeling well, and my boss is telling me, and I'm stressed out, and my boss is telling me to do this. Am I actually supposed to do it? Whether I should do it, whether I should take the challenge, how it is going to reflect to my body. That questions should come to you in your brain when you are at a work, because this is a work stress and work tension, and that will put you into depression. If I won't be able to do it, my boss is going to tell me off. At that time, I'm in a still bad and a worse position. So, what should I do? What should be my decision? What will be my final work to do? And how can I take the things further? So, at that particular point, I would rather say the people will, your brain will answer, your body will answer, and your quietness will answer. Once you take the challenge, do the job perfectly. Okay, fine, I have taken it. What you do, take a glass of the coffee, tea, whatever you have got it, and you started taking it over. And you're doing your job properly. But afterwards, okay, not now. Now I had enough. Next, the boss got a habit that, oh, yes, my assistant can do everything properly. So let them hammer him on the more and more job. So they give you back. But that stressful condition, you shouldn't take it. If you feel it, that yes, so that time, it is your brain, it is you who are supposed to you are the decision maker, and you have got the tension in front of you. If he tells me to resign, that could be the position, and that could be the stressful condition or the time that you will you'll reach to. But then you have to be prepared for that. Your preparation should be for that too. That if he tells me resign, I can talk to him peacefully. But if he bombards, I will give him a time to peacefully. So these are the thoughts which you should have it when such kind of the situation comes up in your life. And peacefully, slowly, quietly, calmly end up with something. And what to do? Take that. I'm talking of one situations of the short term depressions today, and then coming up to that. So, this is your work pressure. Work pressure. And then, if you still feel it, oh, I'm really today very, very badly depressed. I'm really stressful, because that stress is the main root cause which will put you into, like a anger. It will eat up you, and then it will put you to the depressive condition. That, oh, hang on, I don't want to see the person's face. That will be your position. So, what to do at that particular spot? Have a nice cup of tea, and with that, have a nice a small piece of a cake, or some sort of a sweet things like a biscuits. If you're diabetic, I can understand the diabetic people have got most problems in such situations. So what to do? Instead of that, have a glass of a milk, and then have some nice fruit like a banana or an apple, which are juicy and nice, and relax. And keep on having it water. Give 5-7 minutes break and start thinking all the questions which I said to you. And slowly, instead of anger, instead of retaliate in such un in such unacceptable manner in the workplace, what one should do? One should keep calm, quiet, and sit down, have nice warm glass of a milk and apple or banana or any of the fruits which is not sugary if you're diabetic. If you're not diabetic, have a small biscuits, cream biscuits, sugary biscuits, and a glass of a tea or a coffee. Don't take coffee, take tea or take a juice. That's another way of having it and relax. After 5 minutes, your questions will be automatically start giving answers. Believe me, your answers will be with you. But if you start showing your retaliations and if you start showing the reactions towards the thing which has been given to you, I think that will be the stage that you will come up with the stress and stress to the depression straight away. That stress will come. Oh no, I can't do it. How will I do it? How will it happen? You know that stress, panic will end up with the depression. Your brain will stop thinking. You will be confused. You're bound to make the mistakes. You're bound to do so many in rush. And your power of thinking, power of expression will go away. So my question comes up at that spot that in such scenario, you will, or what will happen? You can't cope up. Oh God, what will do? Start crying. Start, your eyes. It's like you will come up with the tears in your eyes. You will be absolutely worried. You will be fearful. That sort of a thing. And then you won't focus the thing that you are supposed to focus and do the job. So that's all the problems which will happen. And you will have the forgetting conditions as well. What you are supposed to remember, you won't remember that as well. So understand the stressful position or the work stressful place. Once you have got, you can get away with once, twice, but not regularly. At that time, you will be answered straight away. Ask your friends, no, this is happening every day. How will I come up? And then the answer will come up to you. Understand, tell the boss that, sir, none of the workplace can stress you and put you to that position which is beyond your body capacity. Or you can come up with some solution. You can come up while talking with your in charge, talking with your boss, talking with your manager. You can come up with some sort of a solution that, sir, this is the position. Make them understand. Come up and then prepare your mind, prepare your body to that target which you have come up in the meeting and have found out the solution. Believe this happens because every boss or every workplace is not that bad that they don't understand their staff and the responsibilities around. Everybody understands everything and they are always there to cooperate as well. There are few times that they don't, but most of the time they do all these things and they are all there to cooperate. Second, it happens that schools, in the children, when you're changing the schools, when you're changing the environment, when you're changing the house, well, there is a lot of thing changes in the life of our children because children are playful. Nowadays, it's a different scene. It's a computer and a gadget system. So if you're changing your Wi-Fi and Wi-Fi is off for few minutes or some time, oh no, there is going to be a bomb blast in the house. So that is one more thing in the children. Or if they want some of the gadgets for their own play, if they don't get it, or if the game is not in their hand, it's a blast game. And the parents, they come up with loads and loads of trouble. So at that time, what to do? So that's a second problem. With the children, there are always been a ways out, as I said, because children are not just one. They themselves are surrounded by, nowadays the life is in, indoor life is more than to the outdoor. Put them into the outdoor life, put them into the liking, and bring them out slowly and slowly. Oh, because you don't get that, you won't have this. You want a game? Okay, fine. You do this, and then I will give you a game. You ride a cycle or a bicycle every day, half an hour, I will give you this. Do slowly. Sometimes it doesn't work that way. I understand that because children are, they are like, they are a very, very timid and they are not well developed. They have got a strong impact of the surroundings and the environment. They get, con- then you have to put them into emotional. I remember I had a case where there was an Xbox. A very simple example I'm going to give you about the Xbox system. What happened with that Xbox? That particular Xbox was, one of the child wanted to have it and one already had it. Oh, you get the Xbox. Oh, I'll tell my mom. I'll tell my dad. They will have it. Forget dad won't give me, but the mom, I can make her convince to get the Xbox. What happened with the Xbox? Okay, mom, we are going out. And then they see, mom, can I have, you told me to buy today. You know, it is just 200 pounds and you say you got money. So why don't you get me that? You know, the child is so much buttery to the mom. And the mom said, no, we can have this Xbox. Now at that time, the child gets stubborn. They sit down. They become little stubborn that no, mom is not convinced. So they, you're not to be a perfect mom. You're not the right mom. You're not like that. They try to put you to the exams and they try to put you into the emotional conditions. Instead, before they drag to you, you put the child into that emotions. That look, you said you've seen it. I don't say no. Never say no to the child. Yes, I wanted to buy for you, my love. But mommy, she's working so hard for you. She's doing so much of a job for you. And you yourself is working so hard. So diversify. This is called as the children emotional blackmailing. Parents have to do it. Conditional doesn't work, emotion works. Emotion doesn't work, bribery works. But we have to work to bring them out of this. And you are handsome, you're smart, you are like this, you're beautiful. Why don't you do this? You'll be smarter. And I can give more time. Come up the the clever children, you have to mold them. That's a management. That's a real part of the management. Not to shout at the children that when we were young, our parents never gave us and these and that. No, that's not the way. That was a time. Now the time is changed. The children, when they are born, they are understanding, they have seen this. So they are expecting that this is the usual. When in those times, in the olden times, where it wasn't that, the parents and that children, their attachment and the bonding was in a different manner. It doesn't sustain that way for every and years and years. You have to be very, very cautious as a parent. If you're a grandparent, tell your children how to tackle their children, because it is never ever the consistent society. so the children can be molded up. Never say no to the children. They say, yes, I wanted to buy. Then, oh, so sorry, I forgot. You can make like a crying face. So children, they feel that they feel ashamed of themselves. Oh, I wanted to buy a Cadbury, but I forgot, my darling. I am assuring you that whenever I come, I'll get it. That next will never come or may come after 5 days. That's the way mold your children to bring them out of the stress, because that will that will put them into the thinking. They are timid. They are not. They are a raw model. Their brain is not developed. They can be easily pushed into so many wrong things. And then we are the one who can bring them out. Because any of these will put them into hatred and depression. It is a short term. The school is also one of that. And certain type of the situations where the social interactions, when they are in the house is changed. They are the footballers, the people are not around, they play with them because they are the newcomer and they are not of the type. Or the changes of the school, where they are from the independent to the private school, they are going to the public school or the secondary school public. Then that is another changes of the atmosphere. The bullying is another part. Bullying is a very big thing. They are putting the children into the depressive conditions a lot by the seniors or by the classmates, because they are from the timid private or an independent school. When they go back to the secondary schools, and there the children, they have been bullied a lot. Then toothache is another kind of the children problem. Earwax is another kind of the problem. They crying, and then they are depressed. So it's a children problems which is putting them. So understand why the child is crying. The tummy ache, ask them. Don't shout at them. And even if my tummy is hurting, because you don't want to study, that's why your tummy is hurting. Don't tell them that way. Understand. Make them sit down. Calm down. You are much, much matured than your child or than to the children with whom you are dealing with. If you're a caretaker, you have to understand this. I know some of them are so notorious, and you daily do this job, so you're fed up of it. But there again, you are a boss. You have to have a control. If I, as a doctor, lose my temper to my patients, how will it be? Think that way. And then you take that responsibility on you. Make them understand management is one part. So that's the children part. Third, as I said, first I said about this ecological, sociological, parental arguments, all that. Second, I said about the children. That's the another thing. Third is about loved one and the loss, miscarriages, certain illness, certain problems, certain long term illness like a Parkinson's, like you get the Cushing's disease, like you get the HIV, you get, someone is lost, like in a maybe it's like accidental death. Then you have like a father loss or mother loss or wife loss or any of son, children, these kind of a thing. It's a bereavement and a grief. It's a difference between a bereavement and a grief. Grief is what? Grief is a situation. Like your pet loss is another factor. You are losing your pet. Okay, fine. Your pet is lost. And you are, oh, my pet is gone, my cat is gone, my, I've seen the people have taken the ashes of their pet and they have done the rituals in, and they have done the worships and what not for the pet, that they could do it. I've seen them. They love. It's a heart. Love is blind. I said these four alphabets are so important in the life that it is blind, and that can be showered. So the pets are also one of the kind where your bereavement comes. And then what? You don't feel like going out. You always keep on thinking about it. And grief is what? Grief is just the rituals that you are doing it. Like somewhere they bury them, somewhere they put the ashes, they do cremate them. There are a lot of rituals and rites, and they try to do some sort of worships, and they do the services in the church, and quite a lot of things they do it. But this is what? This is a grief. And bereavement is within your heart. Don't let it stay for a long time. Don't let it stay. The bereavement always comes even with the termination illness, like a cancer, like a HIV. And I've seen, because I myself have declared the patients who are with the positive, HIV positive, and I have to tell them. And instead of the patients, I know how the patients will go through. So I have to call the relatives and I have to tell them, I'm sorry, but it's a confirmed case. And at that time, it's not the people, the house people, the family, they themselves are facing. They come to you again and again and say, Doctor, how can we come out of it? How will we absorb, and how will we tell? I've seen the wife coming back to us with the children, that this man has come with the HIV positive. I am HIV positive. Look at my children, doctor. How am I going to go through? I've seen those cases in my life as well. And I have gone through those era of the life as well. With the experience, we are out to swallow the things. But the family who has not gone through, they will definitely end up with the depression. So, in such scenario, what are the ways that we can do? Very simple. Bereavement. Diversify your life. You are interested in what? Music, reading, outward activities. Diversify. Otherwise, that bereavement, that depressive moments, that thoughts will end up with the suicidal, will end you up with a long term depression. It's a prolonged bereavement. So one must, you start shouting, oh, the person gave me that. I always tell them, let it go, let them speak. When somebody comes to us with the termination disease, it's, somewhere when we have to tell them with the testings done that, yes, your test is such that I don't think so you will have a chance to be or to have a biological child. That's a death point of a newly married couple, because they are desperate to have a family. And that's not right. So, these kind of your thoughts, I'm coming up. Now, what to do? At that time, there is nobody, but you have to find your brain and mind, they are losing their whole thought. Their brain and mind, they're losing out the complete connection, because you're depressed, you can't think, you have got your self confidence gets ruined. First point, eat. Start with a small thing, regular eating. And what will be the start first? Have some sugary milk, because the first effect is the sugar of the body. Anything bereavement, you take it. So always, whenever anybody said, have you had a water? Have you had a cup of tea? Have you had something? We always give them something which is a sweet. That now you start with the sweet, and forget about those things which has happened in the family. There are certain rituals which have been created, that you distribute the sweets when there is a burying or some church services happens. They give you something, and they have the dinner in the evening in Christian, after after that burying, or after they go to the graveyard. In a certain community like Hindus, they have got, after certain days they give the sweets, or after 12th day they give the dinner and all that, which has got the sweets within. What does this indicate? That indicates that come out. You have done bereave, you bereaved for the lost, you have bereaved for the gone. Enough. Now this is the time. Have sweet, and then come out and create a sugar level up and high in your body, because you have lost that sugar level. It is always that. It always happens. Your sugar level goes down. And that's why your brain and your body, they loses out the connections. The connections are lost. And that's the point where we need to understand that please come out of it. The bereavement time is almost gone, and you have to understand the next one. So that's the best way. Then slowly and slowly upgrade your diet and see your energy, because your energy is gone. Now your energy will come, your brain will start responding, and slowly you will be out of that bereavement. When it's a loss of your beloved one, your really nearest ones, and all that. But if you have got the long term illness, if you start with this, your mind will get that energy to think different. And then you will have to sit down, calm, cool, and move ahead. That this is the cause. Now, this is a life. This is it. It's happened. Now, what next? That your brain itself will give you that strength to think further and take the advice of the doctor, of your GP, that yes. And then another part is a cognition, that this is the thing. The doctor, if I think your GP will mold you, definitely they will tell you that yes, diversify yourself and don't leave at that time, because that's a crucial moment. So don't leave that. At that time, start putting in exercises, start putting a work on you, that what you like it, like a music. Oh, every now and then, you can't be 24 hours, 24/7 with the music, but you like it. Do some sort of a thing. Let's start moving, going out. Leave your indoor life. Move out. Go out for a shopping. Sit down for a movie. Sit down, go and talk with the friends. Join some community level. Join some activities that will put you into some sort of a changes instead of medications. Easiest way is a medications, but instead of that, go through those kind of a thing, and then believe me, you are the best. You will be able to come out of this very, very well. So it's you people who will have to come up of this. Secondly, um you have got some of the kind of a divorce, or some of the social problems, like the early retirement, or you have got some financial situations which is not right, or the country situations which is not right. That's your surroundings and environmental, or you have been pushed into the um, such a home care which is not suitable to you. There are a lot of things, especially in a young people, or young people, they have got the teenagers, especially they have got the love and breakage. That is another kind, which is that the relationship is being broken down. So these are all the things which are there. And that time, it is the positive or negative, but always think and go on the positive side. You've seen some stressful, distressful accident where your brain is gone and you've seen the blood showering out, and it's you can't think of that. You've seen the person like hammering and beating and all that. Your brain can't take that any longer. Don't do that. Your brain says that's a stressful position. At that time, you come up with a short term depression. And that picture doesn't go away from your brain. So instead of putting yourself into traumatic position, or put into anxiety condition, or put into any other diseases, behavioral problems, the best part is to get into a relaxing and some kind of exercise, or some kind of diversify yourself immediately, and then you can come up with quite a lot of solutions which are likely for you. So make sure of all these kind of a thing, and then you can think about it. So, these are the best place. Cognitive therapy is one. Secondly, is the ACT. It's a kind of a compulsion. You like something, but you don't feel like you like something which is there, but at present, because of the depression, you don't like. So it's a identify and as a compulsory, put into the practice. No, I must do this because I used to like it. And I'm like that. Why it happens? Diet. Like vitamins deficiency creates this. Hemoglobin deficiency creates a depression. Your certain personality problem creates a depression. These are the small, small things that creates a depression. It's a behavioral. Because of this breakage, divorce, illness, these, that, quite a lot of things which happen. So it creates a problem. But at that time, eat a proper diet. In the morning, proper cup of tea with a small breakfast, which is a nice and nourishing, like a cornflakes and all that. Second, proper, full, healthy meal, which you are used to take it before. You may have a little because you don't feel like eating. Depression always decreases your hunger, but it doesn't mean that you can't have that. Lastly, in the every 2 3 hours, keep on eating and add a little. If you're not diabetic, add a little biscuits, or add a little, like a sugary things like a bananas, or something which is there, peppermint, or something like that. Keep on having it. So, what happens? By that, your sugar level rises up. Have salads. Salads are the best nourishing part. Because of that, you can have digestion proper. Some of the iron can raised and can be increased in your body. That's a deficiency can be recovered. Secondly, your healthy diet and full diet will let you have the vitamin deficiency to overcome. And the fruits are the full of vitamins, so you can have them. And lastly, in the night, depression is one place where you don't get the sleep as well. Your sleep goes away. You feel lousy, lazy. You don't feel like, sitting down, looking at a one thing. Like your brain is gone. Or you start crying, the tear comes out. Your it's the lousy conditions which is there in your body, which you are not actually that. So what will happen? At that time, take a sleep. Your sleep goes away. So, what is the thing? Why you sleep? These are the vitamin, iron, certain kind of a proteins. Those deficiency happens. Your healthy diet will put you that. Secondly, egg. Egg is one, and the fibers are second. They are the best food. Glass of a milk is another best food. They all give you to certain level that you can get the best of the sleep. And especially with the children, when they have got the examination time, they are always stressed up. And then they say, I'm stressed. I can't do this. So at that time, the best part, have a little but nutritious food. Have a egg sandwiches, have a glass of a milk in the night, get up early in the morning, and then say, and start work with your work. These are the best way to come up and come out of the depression. Some of the tablets like thyroid, hypothyroid tablets, they give you some of the heart tablets, they give you the diabetic tablets. Diabetic is one part of a thing. You are taking a diabetic tablets because doctor has said I have to take half a tablet. So you are taking insulin. Oh yes, but have you ever checked your sugar level? No. If the sugar level goes down, you're bound to get some sort of a problem of the depression. So get your sugar level and checked regularly if you are diabetic. If you're non-diabetic, okay, that's fine. But sugar level has to be consistently kept, never to go low, never to go high. Has to be in a level. Your blood pressure should be normal. If it is not, you find it's fluctuating. Fair enough. Check it because you feel your body, you feel little bit heavy here in your brain, you feel little heavy at the back. And why? Did you had some heavy food yesterday? Start thinking. At one age, old age, at one particular age, you have to think. If you're pregnant or if you're delivering, if you've delivered baby very in a recent future, think about your health. During pregnancy also, you get a swelling on a feet, you get, lots of this one hiccups and all that, you get lots of burping. No, it's okay, but then excessive, you have to better get it checked because your baby is in your tummy and you are looking after that. And never take stress at that time. People said eat everything. Okay, eat everything. Have you ever thought of the nausea? Nausea is one of the factor as well, which comes up till 4 months. So think while you are pregnant and keep a regular check. My question is, these kind of tablets, hypothyroidism also one of the factor that is trying to level your thyroid level, but at the same time the thyroid level lower and up and down, especially when I was talking about the hormones at that time. Secondly, menopause. Menopause is one of the biggest, funniest part of the body in the female, which will put you up into all these trouble. It's a short, but understand that. And keep your diet regular. Diet regular is the most important factor. Even in the children, I tell you, I have seen the children who are born, who are malnourished at the month of 4-month-old child, can't even sit properly. They're malnourished. But it's a challenge of the clinical advisor who is coming to you and the mother who is understanding the factors why the child is like that. Get the challenge. See the development in the child. The brain is not developing. Why? Your brain is fine. Your family members' brains are fine. The child is so small, timid. It's just a newborn child and it's not happening. So instead of listening to old people, oh, these used to happen when you were there. Yes, run down, talk to the clinical person and get their advice. Maybe it's a malnutrition. The brain is not developing. It's not just one thing. They get the nausea, or they vomit out very frequently the food that you give. Why? Then what happens? Take these for a month. You believe me, the child will be fine. It must be a small twinge things, and that way that will put your child into a dull position. The child is just like that because the brain is not cooperating with the body. It's a timid child of a 4 month, and that needs a mother care of a mother instead of just looking after here, there, and everything. Look after that as well. Understand sometime. And I've seen the case. That's what I'm telling you. It's simple. There was a child in my practice came to us and then said, "My child brain is not developing. The weight is not putting on in the child." Okay, fine. Next comes. What to do? The child was crying, had no sleep properly because that's a part of a depression in the child. Why? The child was in the foster care. They haven't seen the face of the mother. The foster carer was like that. And then the child came to us. We advised the foster carer, send the clinicians, and they said, let's start first of all, what sort of a food you are giving? We started basic with the food. Food came up. The child started showing. The 5 months child wasn't even sitting. Forget about sitting, was just consistently sleeping. In a month, started sitting properly. Can imagine the development of just the food in a month. The child wasn't sitting properly or doing anything. Actually, child should bend at the age of 3 month or a 4 month, which wasn't there. But started with that. Then we found out the clue. Yes, it's a nutrition. Now bombard on the nutrition. How come child can't do the proper? Started with all the calcium, yogurt, these, that, 3 months, 3 weeks, 3 hours, 2 hours. You know, the poor child is like sleeping and eating. The mother was saying, I feel so pity for the child, but can't say no to it because he need to grow. You know, that was the position. The foster carer took care. The child is at the age of 11 month, 12 month, started walking perfectly. Why? Was this very small thing. Diet. The same thing with the short term as well. A diet, connection between brain and a body. Don't go straight to the antidepressant. Go with the vitamins. Go with the exercise. Go outward. Go with your liking activities because it's depression is diabetic patients. If they have a depression, run down to doctor. Start and sort out your insulin dosage instead of taking, oh, because of diabetic, I'm feeling like that. I am not getting a food. Yes, diabetic patient needs food in time. They need medications in time. They need a proper food. But the medications and the food should not be to that level. They have to keep intact with each other. They are like a parallel. The thyroid patients, they have to understand about the thyroid level to be kept intact and they need to be checked regularly. The diet is a very important factor. And if you people understand that, I would rather put you to that there is nothing which can stop you. Anyway, I would rather now welcome the management part is one. Any have got any? Because it's just a broad thing. I have not taken biological depression and the problems and anxiety and all that because these are totally different. The depression can happen with the pregnancy, which is also connected with something. So I've taken just the simple part of the management. Anything happens, please understand. Don't take alcohol. Alcohol is the worst. Never ever take. Don't take any caffeinated drink. That is not right when you are depressed. Don't take any caffeinated thing. Don't take alcohol because people go for substance abuse. People go for any of those kind of a cigarettes, smoking, these. Don't take that. That is not the right management. I still tell you that will accelerate your depression. You will become more and more depressed. Even if you have got anger, even if you have personality, if you have got that, if you have got any such bereavement, oh, I take a beer, glass of a beer is enough. You'll be cheerful. A pack of a whiskey is enough. You'll be cheerful. No, that's not right. Even the tea, light tea powder, caffeinated, totally avoid. Milk is good, juice is good, fruit juices are good. Then you can have a water, you can have all those kind of a thing. You can have a Sprite, you can have a Fanta, you can have so many things, other drink, but don't take Coke. Don't take Coke. Aerated is fine. That is tolerable. That's fantastic. You can have those. Don't take alcohol. Don't take any substance abuse because substance abuse itself is going to give you depression. It's a part of it. If you are substance abuse of the morphine or the drugs and all that, don't do that, because multiple sclerosis, you need those things. It's such a huge pain that the patients are given that, and because of that multiple sclerotic depression, the thing the cannabis, and which has been given some time to them as well, those injections which are permitted for to give them relief from the pain, those are the ones. Please, at that time, don't do that. That depression is different. It's a temporary for that injection. But don't keep a habit of it. Don't take any these kind of the tablets, antidepressants, for a long time, which are harmful to your health. So make sure what you should not and what you should. Make sure these are the ways you can manage. And bereavement is one of the worst thing. Come out a short depression in 4, 5 days, 7 days, 10 days. The children, bring them out. If they're sitting quietly, slowly grab them, inject them, bring them out of the house, make them play, because that computer consistent is not right. They are going to fall into it, and they will end up with some sort of a problem with the gaming, gambling, and depression. So please try to understand and do these things. If you are an adult, and make them understand, they need it, because there's a society, they need to develop these skills, but not 24/7. The mobile is okay, fine, but even with the mobile, tell them to come out from the house, do some activity, diversify them. Schools, colleges, now the schools also need the mobile as well, because that's one of the very big tool they have. But still, make sure that that has to be in control. Make sure that you sleep, but your child is sleeping or not. They need to have 7 hours, 10 hours, 8 hours sleep, a RAM sleep. If it is not, it's important for them, because certain time, the teenagers, when they are growing up with the hormonal stage, they don't do this, they don't sleep well. Then make them sit down. Don't shout at them. Your time was that, and my time was this, and I was this, and that was the. No comparison. Calm, cool, as I told you. Believe there will be a harmony, there will be a happiness. Diversify. You will never end up with the depression. You will never ever end up. You'll always be in a smiling. Everyone has got a problem. Everyone has got a changes in their life, but everybody doesn't fall. The emotional and emotionalization and certain problems are putting you to this stage. This is a short term stage, and every short term has a solution. And if your mind and your body is connected, then only you can do that. Your proper diet, your regularity is there, you can do it. Otherwise, it's not. Go and take the advice. ACT therapy is there. That's a compulsive, accurate compulsive therapy. Cognitive therapy is there. GP advices is there. Psychologists are there. They have got loads of other methodology which will put you to this, and which will connect your brain and will bring you out of this problem. Because it's a short term. When it goes long term, sorry, you have to come to me for a medications. So don't fall into that. I would rather suggest you go ahead. Thank you very much. I would like now the answers and questions. Anyone has got it? Anybody has got any questions and answers, please? Hmm. Yes, I have got some of the people who depression is not adding the high BP, but high BP is the part of the depression. Sometimes high blood pressure will put you to low calm condition, and this high blood pressure is because of what? That you have to say, that you have to think, and then you can think about it why this is the position. It's a anger, it's a stress. If you're a blood pressure patient, better check your blood pressure. If you have got a thyroid problems, better check the blood pressure with the thyroidism. BP problem, better check your blood testings done also, then you can do the things. How to know the person is depressed? I'm going to take this is a very important factor, and I'm taking this depression and their symptoms next lecture thoroughly, because this is a very important factor. Person is depressed, the depression is of many reasons. And then I gave you today a basic ground, going to give you the therapeutic and how to know the person, what are the symptoms of the depression and why they get depressed, what they show, in which conditions they are depressed, because it's a different way that the person show the depression. It's a children, they show in a different way, the adult they show in a different way, the old age people they show in a different way, and that's all the things I'm going to talk to you